Hi, and welcome to our November Cancer Prevention and Wellness Series program presented by the Cancer Survivors Park Alliance. Today, we're grateful to have Molly Sleigh on our call today. She's going to be discussing healing, restoring, and thriving, the role of rehabilitation in breast cancer care. This is an incredibly important topic, and we're so grateful for Molly's time and expertise with us today. Thanks, Molly, for being with us. Want to introduce Molly real quick. Molly is a certified oncology, lymphedema, occupational therapist here at the Center for Integrative Oncology and Survivorship at Prisma Health Cancer Institute. She has been with us, and we're very grateful to have her on the call today to talk about her experience as well as her expertise on many topics. She holds certifications in oncology, rehabilitation, as well as lymphedema. Thank you, Molly, and thanks for being with us today.
Thank you so much for having me, Rachel. The title of my talk is Healing, Restoring, Thriving, the Role of Rehab in Breast Cancer Care. Next slide. This is just a little bit about myself. I've been working in oncology almost my entire career. I have a special heart for working with breast cancer survivors. I have worked in the academic setting and the clinical setting as well in 4 different states. I've devoted almost my entire career to working with those with lymphedema and impairments related to cancer treatment, and volunteered a lot of my time to serve on numerous boards and patient advocacy efforts. Thank you. Next slide. The objectives of today's talk are to, number 1, define the role of breast cancer rehab and its importance. Number 2, identify 5 side effects of breast cancer treatment amenable to rehab efforts. And number 3, identify strategies to help offset or mitigate the negative side effects of breast cancer treatment. Next slide. So what exactly is breast cancer rehab? Breast cancer rehab is a multidisciplinary approach that helps survivors regain function after undergoing breast cancer treatment. And we do that by reducing the negative physical side effects of cancer care that may cause functional impairments. The goal of breast cancer rehab is to restore your function and quality of life. You may receive breast cancer rehab in the setting of a physical and or an occupational therapist. Next slide.
Wonderful. And this topic really can't be understated how important it is. Breast cancer treatment can be a grueling process for some, and it's really up to some of the providers that help around the specific oncologist and nurses that can help restore quality life. So, such an important topic. Thank you.
Thanks. So why is breast cancer rehab important? First and foremost, rehab efforts are important because it can help improve your quality of life. Additionally, cancer rehab is specialized according to the survivor's needs, and it is impairment driven. In other words, the skilled therapist who is trained in breast cancer rehab or has experience in breast cancer rehab is very skilled at doing a physical assessment and identifying some of those negative side effects of breast cancer treatment. We as therapists treat the problem that the patient describes. So for example, if you want to be able to push your child in a swing again after breast cancer treatment, or throw a ball to your dog, we kind of look at some of the musculoskeletal problems or chemo-induced problems that are preventing you from doing those items or those activities that are meaningful to you. We address those in the clinic so that you are able to engage in activities that are important to you and give meaning to life. It's really important to note that rehab services can benefit you, patients, at any time point along the cancer journey. We are able to see patients that are newly diagnosed, patients that are free of disease, or those that have metastatic disease as well. Oftentimes, the after effects of treatment can last many, many, many years. And there may be new late effects that come along with treatment that we can really identify and help mitigate in the rehab setting.
Molly, where is your office? Are you guys within the treatment center for cancer patients? Are you outside of the system? And what does Prisma offer in terms of these services?
Within Prisma, we have a clinic housed within CIOS, the Center for Integrative Oncology and Survivorship, where we have therapists that are trained to identify and mitigate the side effects of breast cancer treatment. We also specialize in lymphedema care, which we'll talk a little bit about as well, secondary to cancer. But within Prisma and within our clinic here, we are housed within CIOS. Some of the common side effects of breast cancer treatment may include scar tissue after going lumpectomy or mastectomy and or breast reconstruction, radiation fibrosis, which is that hardening of tissue that can occur after radiation treatment that can cause pain, discomfort, and swelling. Many patients have nerve pain or shoulder pain or loss of mobility in their shoulder that prevents them from reaching overhead, from getting dressed, from lifting weights. Many of our patients who undergo breast cancer treatment have significant fatigue or delayed healing. One of the side effects of chemotherapy is peripheral neuropathy with numbness or tingling in the hands and feet or weakness. All of these common side effects of breast cancer treatment are amenable to rehab efforts. Next slide,
Well,
please. Oh.
yeah. What percent would you say of cancer patients have some of these side effects, specifically breast cancer patients?
Well, if you look at the data, over 70% of breast cancer survivors develop some type of problem in their upper quadrant. In other words, in their shoulder, in their chest wall, in their trunk, in their back. 70% of breast survivors develop some type of musculoskeletal issue. If you look at the data as well, 20% of all breast cancer survivors will also develop a condition we call lymphedema, which is a swelling that can occur in the arm or the chest wall as a result of radiation and or removal of lymph nodes.
Okay. Follow-up question. Are oncologists actively looking for these side effects in their patients? Is this something that patients need to be speaking up about? What kind of is your experience and what you've heard from your patients?
What I hear from my patients is that oftentimes these side effects are overlooked by some of their providers. I think that the focus on the med onc side and the radiation side is saving your life, of course, which is very important. I will say that it's important for patients to be very proactive and advocate for themselves. If you are feeling any of these side effects or experiencing any of these side effects due to your breast cancer treatment, it's really important to speak up and directly ask your provider for a referral to therapy.
Yeah, you guys are such valuable members of the care team, and I'm glad that you're telling people to advocate for themselves. That's very important.
Mhm. So, one of the questions that I'm often asked is, why is this healing taking so long? I've finished my surgery, I've finished my radiation, my breast reconstruction has been completed, and I'm 6 months, a year out. Why am I still having all of these problems? Why am I still having pain? Why can't I lift my arm overhead? And what I try to tell people is that I'm a runner. So, I always like to use a running analogy. And I will say that recovering from breast cancer treatment is more of a marathon. It's not a sprint. And you're going to go through a roller coaster of ups and downs when it comes to healing, because there are later effects that come along sometimes with breast cancer treatment. And if you think about it, your body has gone through significant trauma, and we know that healing occurs in multiple phases and it's not all at once. We know that radiation and chemotherapy sometimes can cause delayed healing at the surgical site up to a year or longer. So it's not going to be quick, it's not going to be easy. So it is going to take some time and it's going to take some work too, which we'll talk a little bit about. This is a slide with some of the tools that I use here in the clinic with my breast cancer patients. At the top, you can see a box of kinesio tape. Oftentimes, if you're watching sports on TV, you see athletes wearing tape on their legs or on their arms or on their shoulders. This is a tool that we use with scar tissue and also with swelling postoperatively or with lymphedema. That pink little rectangle is a piece of Dicem. That's something that I typically give out to patients and then instruct on how to do scar massage using Dicem. You see some cupping tools there as well. And at the bottom, that is a scraping tool. It looks really scary, but it's not. Some of my patients, when I take that out, they say, "Oh no, you're bringing out the ice skate." It's really not that bad, and it is something that's very effective to use on scar tissue and also on radiation fibrosis. Next slide. Talking about scar tissue, when we talk about scar tissue, there's internal scar tissue and there's also external scar tissue. So when we talk about scar, it's not just the surgical scar line, it goes much deeper than that. And it's something that you really need to address on your own daily for a year. And that's something that we as therapists can instruct you on. The way we treat scar tissue, first and foremost, I tell patients to rub it like you love it. Spend a little time every day doing some heavy, deep circles, some scar massage. You can use the Dicem, which is that pink rectangle you saw in the earlier slide. It's very sticky and it allows you to really get in there and work that surgical scar line so that you don't get adherence, so your chest wall doesn't get stuck, which prevents you to raise your arm up overhead. We use cupping, we use that ice skate tool that you saw earlier, the scraping tool, kinesio tape and gel as well. Next slide. This is just a slide I took of one of my patients. You can see she had a double mastectomy, and this is just an example of how we might use the kinesio tape in the clinic. On our left side, you can see the X pattern that we often use to help break up scar tissue with the kinesio tape. On the right, that is a taping technique that is used to help move fluid or swelling. You can see in her chest wall, she does still have a little bit of swelling left after that mastectomy. And by using that kinesio tape, we're helping to kind of move that fluid out of that quadrant. Next slide. Radiation fibrosis is something that most breast cancer patients experience if they've gone through radiation. Radiation fibrosis syndrome is a pathological condition that's characterized by the development of fibrous or scar-like tissue in areas of the body that is exposed to radiation therapy. Fibrosis is defined as an abnormal accumulation of collagen fibers, leading to stiffening and thickening of the affected tissue. So to put it in simple terms, radiation fibrosis is that hardness that occurs in the breast or the chest wall after radiation. And I like to compare it to linen material in the earlier stages or like canvas material in the later stages. Early on, immediately following radiation, that post-radiation healing, with that occurs mild collagen overproduction, or those fibers are just kind of starting to lay down. And I compare that to linen because the tissue can still kind of glide and the layers move with a gentle stretch. However, as time goes on, sometimes that fibrous tissue can really start to lay down more and more and really harden, and that tissue becomes more like canvas, meaning that it feels heavier or more rigid than linen. It moves more as a single sheet versus the layers kind of gliding over each other. So I like to use that material as an analogy of what happens after radiation. Usually the radiation tissue changes peak around 12 months. So the side effects are not immediate. And the way that we treat radiation fibrosis in the clinic is very similar to the way that we treat scar tissue, meaning that we're working on softening that tissue using very similar techniques that we use to soften scar, just on a larger area. Stretching is very, very important after radiation, immediately following, and oftentimes for years to come. Because with radiation, radiation wants to tighten the tissue and tighten the muscle. So you're going to be fighting the effects of that for a long time to come if you've had radiation. The best way to do that is with stretching. On the next slide, Rachel, if you want to go ahead and advance, this is one of my favorite bras that I like to prescribe to women that have had radiation. It's a compression bra. It's made by Prairie Wear, and it's called the Hugger Prima. And what I like about it is that it zips up the front, so it's very easy to put on. It comes up very, very high, and it comes up underneath the armpit, which is where many women tend to swell after surgery or after radiation. That image on the right, that's called a breast swell spot, and it is filled with pieces of chipped foam. And I like to have patients kind of tuck that inside the compression bra, pull it closed, zip it up, and that swell spot really helps to soften that radiation fibrosis that we see.
Does Prisma offer any ability to get these or to be fitted for any of these garments in the clinic?
Yes, luckily we do. We are very blessed. We have a fitter here on site through CPO, just down a few doors down from our rehab clinic. So it's very easy of coming here. If your therapist prescribes compression bra for you, we literally can just walk you a few doors down, and you, more than oftentimes not, you can leave with it.
Wow, that's awesome.
Next slide. So another side effect of breast cancer treatment oftentimes is nerve pain. I hear patients complain quite a bit about the zingers, the electric shocks that they feel, and what is going on with that. Nerve pain can come and go as you heal, because there are multiple pathways for nerve pain. And I always tell patients that if you think about it, mastectomy is really an amputation. You are removing a body part. Lumpectomy can be just as painful. Women that have had mastectomy can have phantom symptoms, phantom pain, and it just takes time for those nerves to regenerate and heal. Oftentimes, women that have had lumpectomy are very hypersensitive to touch. They don't like to be hugged. It's hard to tolerate clothes because just tapping that skin or pressing down on the skin can be very painful. And it's really hard when I have a patient who comes in that needs to have a scar worked on or radiation fibrosis worked on, but their nerve pain is so great that it's hard to even touch them. So one of the tools that I like to use, and I encourage patients to use at home, is vibration. Because believe it or not, vibration can help to desensitize the breast before the therapist gets in there to really work on that scar tissue, work on that radiation fibrosis. It helps to calm down the pain. It's hard for me to do scar massage or mobilization without trying to calm down that hypersensitivity or that oversensitivity in the breast. And one of the things that I like to use, and I encourage patients to use at home, is vibration. If you skip to the next slide, Rachel, I have a slide up of a tool that patients can order on Amazon. It's called the Magic Wand. You can get it battery powered or electric powered. Order it on Amazon. It's not expensive. And that is a tool that you can use on your own, on your breast tissue. Just turn it on, put it in different places around the breast. At first, it really hurts, but over time, it helps to really calm down those nerve pathways and reduce that hypersensitivity so that you can once again tolerate wearing a bra, tolerate a hug. things of that nature. Shoulder pain. 70%, like I mentioned earlier, 70% of all breast cancer survivors experience some type of upper quadrant dysfunction, meaning they have some kind of impairment or musculoskeletal dysfunction on the side that had the lumpectomy or the mastectomy. And one of those things is tightness in the shoulder, specifically what I call the chicken wing or the scapula. So the scapula is that bone right at the top of your back behind your shoulder. We call that the scapula. I call it the chicken wing. And when that gets tight, it's hard to raise your arm up overhead. Skip to the next slide, please. And looking at this patient, I've found that the more invasive the surgery is, and or if you've had radiation, that can really affect the way that your chicken wing or your scapula moves. If you look at this photo, this young woman had a double mastectomy, but she had radiation on one side. And you can tell by looking at her which side she had radiation on. Clearly it's the right. And she's unable to raise that arm up over her head because of that tightness in her chest wall, which we did work on in therapy, and also because her shoulder blade or her scapula chicken wing was not gliding the way that it should. And with therapy, we can help with that. Go ahead and skip to the next slide. So what we see, especially in the presence of radiation, is radiation wants to pull that whole chest wall forward. And when it pulls that chest wall forward, it changes the position of your shoulder blade. And you can see in this lower left-hand side an illustration of that chicken wing or that scapula being pulled forward by radiation. The image on the right is just an example of one of the things that we do here in therapy to help mobilize that scap. All shoulder recovery after breast cancer treatment really involves mobilizing that scapula. If you can't get that chicken wing moving or that scapula, it's going to be impossible for you to reach overhead without pain. Next slide, please. This is just another illustration of that. This is called upper cross syndrome. Next slide, please. And you can see in this image of what that looks like. A lot of women or men after having breast cancer treatment end up with a forward flexed posture, neck forward, shoulders forward, and that can really affect the ability to raise your shoulder overhead, or excuse me, raise your arm up overhead. Next slide, please. Once again, this is what this looks like. Your head tends to come forward, your shoulder blades are in. Women that don't have this worked on at some point may develop rotator cuff problems or pain in the upper part of the shoulder when trying to reach overhead. So stretching is very, very important, not just only in the chest wall, but also mobilizing that chicken wing or scapula as time goes on. And I do want to mention and highlight this last point especially. Just because you can reach overhead does not mean that your chicken wing or your scapula in your back is moving well. If it is not gliding the way it should, when you reach overhead, you're going to have pain in the upper part of your shoulder. And it takes really someone who is skilled in breast cancer rehab to understand what's happening in the chest wall and with the scapula in order to improve that and get you over that hump so you can reach without pain.
Are you
Next
giving
slide.
your patients a good amount of like homework? Are they getting specific stretches you recommend?
Yes, all patients get homework and they go home after the first visit with what they're supposed to be doing at home, because being seen in the clinic just a couple of times a week for a few weeks is not going to be enough to get you through that recovery period. So working your home exercise program and doing the things that are prescribed by your therapist are going to be very, very important so that you can get back to doing all those activities that you enjoyed before cancer. Next slide. And I cannot hit this point home enough. Please, please, please do not do that wall walking exercise until you are able to move that chicken wing normally. I cannot tell you how many times I see patients who come into the clinic and they are given that exercise to start day one. Do not do that. On the next slide, I'll show you some exercises that you can do that are more helpful. Next slide, please. Next slide. So some scapular mobilization exercises to do at home before you try to reach up overhead, or just some very basic shoulder shrugs, raising and lowering, laying down on the floor and moving that shoulder blade up towards the ceiling and down, pulling those shoulders back with retraction, and doing some shoulder rolls. You want to be sure that you start with those before you start any type of overhead exercise, because if you don't do these first, you really risk developing what we call a shoulder impingement, or pinching of the nerves right here in that shoulder, which it's hard to get rid of that once it starts.
Did you eventually give clearance to people to be able to more move overhead?
Yes, yes. And one of the things that we really stress is before you strengthen, you have to lengthen. I think that people make the mistake of trying to really get in there and, do weights overhead, add weight, do resistance bands. You cannot start that until we've re-lengthened the muscles. And after we've re-lengthened the muscles, that's the point that we really start adding weight. So doing things in the proper sequence is very, very important. And unless you have guidance from a specialist, namely a rehab specialist, PT or OT that specializes in rehab, cancer rehab, you're not going to know how to safely progress yourself. Next slide. The next topic I want to just quickly highlight is cancer-related fatigue. This is not normal fatigue. This is a deep, weary tiredness, unlike any other fatigue that you've experienced. It is cyclical. If you stop moving, it's going to get worse. But on the other hand, if you do too much, you're going to be on the couch for weeks. So it's really important to try to find a healthy balance to keep moving, to keep those energy levels up. One of the things that I typically may suggest to patients is to try to do a HIIT training, or try HIIT. HIIT is you could try doing a very modified high intensity interval training. So modified after going through cancer treatment, meaning that if you want to start out just by walking maybe 5 minutes a day, and in that 5 minutes, you're going to add 15 to 20 seconds of an all-out walking pace where it's really hard to talk to another person. And over time, you're going to try to increase that walking time. So for example, you might go from a 7-minute walk to a 10-minute walk. And for every 5 minutes that you add, you want to add another HIIT interval. So for example, if I'm going to walk for 10 minutes, I'm going to do 2 intervals of really high intensity where I'm really raising my heart rate to the point that it's difficult to have a conversation. And that can really help build your energy levels. Next.
Do you guys refer at all to the Moving On program at Prisma? Are you allowing people to be more educated about the program? And for those that don't know, that's a structured 12-week exercise program with a trainer actually at our Life Center, the YMCA Prisma Life Center here, right across the street from the Cancer Institute. Are you guys working with that program at all?
Absolutely, absolutely. I think it's so important, and they offer such specialized care for those patients who are really trying hard to increase their strength, to increase their endurance and get back to the level of function that they had prior to cancer treatment. And oftentimes, after we see patients that come through our rehab program, we do refer them on to the Moving On program because it's an excellent way to really get that strength and endurance back.
Awesome.
Wanted to touch a little bit on the M&Ms, metabolism and menopause. Chances are, if you have a hormone-driven cancer, you have been put into early menopause. And menopause, we know, is very, very hard on your metabolism. It can lead to weight gain. It can lead to muscle loss. So it's really important that you incorporate both strengthening and cardio, both, to really address those two issues. And I did talk about trying a HIIT training interval to try to use that to increase your metabolism, increase your energy levels. You don't always have to use just weights to do resistance. You can use your body as resistance by doing push-ups or lunges or squats. You don't always have to go to the gym to get resistance as well. And in terms of diet and trying to lose some of that weight that can sometimes be associated with being thrown into menopause, there are different diets that are out there that really try to cause metabolic confusion, or carb counting is another idea that some people will use. Don't let your body get used to one type of diet, but trying to confuse your metabolism so that it works over time. Next. The last slide we have here is a topic that deserves an entire presentation in and of itself, and this is lymphedema. As I mentioned earlier, lymphedema is a side effect of breast cancer treatment that affects roughly 20% of all breast cancer survivors. It is really important that you are seen by a certified lymphedema therapist who is skilled in identifying what your risk factors are for developing lymphedema and how to mitigate those factors. It's really also important, too, that if you start to notice any type of feelings of heaviness or fullness in your arm without actual visible swelling, it's really important that you get in to see a certified lymphedema therapist as soon as possible. Here within CIOS, we have 3, and we're hiring a 4th lymphedema therapist as well to be able to meet the demand and the need. So if you are at risk for developing lymphedema, unfortunately, you're at lifetime risk. The risk doesn't go away. So it's very, very important to be seen by someone that is skilled and trained in lymphedema treatment to help offset your risk into the future and to address any swelling issues that you might have.
What causes the lymphedema? Is it everyone who has any type of surgery with the breast, or is it specific individuals that are at higher risk? What's kind of the development and who is at risk?
So data indicates that the top 3 risk factors for breast cancer-related lymphedema are radiation, removal of lymph nodes, and high BMI. However, we have really had advancement in lymphatic imaging techniques probably over the last 3 years. And as the lymphatic system is being studied in more detail due to these higher tech lymph imaging tests that we have now, the data is really suggesting that we are all born with differences in our lymphatic system. And some people have more nodes than others. Some people have lymphatic vessels that are a little more sluggish. And what current evidence is starting to suggest is that just depending on how your lymphatics were put together will help determine if you develop lymphedema or not. So I think as this is studied more into the future with the advancements in lymphatic imaging, I think we're going to find out more and more about why some women get it and some women don't.
So really the lymph is building up in one specific extremity because of its inability to drain through the lymph node. Is that correct?
That is correct. When lymph nodes are removed from under the axilla or the armpit, as oftentimes lymph nodes are with lymph node biopsy, um, in addition to radiation, because radiation scars down the lymphatic vessels so they don't work as efficiently as they should. Really, the combination of those two factors causes fluid to build up into the arm, into the chest wall, the breast, and the trunk. So lymphedema can
Yeah.
occur anywhere in that upper quadrant, not just the arm.
Is it painful? Is there other side effects with lymphedema itself?
Yes, there are. Sometimes lymphedema can be painful at its later stages. When a person has lymphedema, they are at high risk for developing a condition we call cellulitis, which is infection in the arm, because that lymphatic fluid is filled with a lot of the dead cells, the waste products, kind of the garbage, if you will, of the surrounding tissues and bloodstream. When that is pooling in your arm, that puts you at higher risk for developing infection in that arm. If you were to get a cut or a scrape or a bug bite, that little opening in the skin could serve as a portal for bacteria to enter the arm, and it would be very easy to start an infection if not well managed.
You guys really do a lot to help mitigate the risk of infection in your practice.
Yes, we do. And we are very good about teaching good skincare practices. Good skincare is very, very important if you have lymphedema to help reduce your risk of infection, making sure that arm is very clean and also very well moisturized, because when our skin is dry, it cracks, and that crack could serve as a portal for bacteria to enter, and it would be very easy to start infection. Okay.
Thank you so much again, Molly, for being our speaker today on our November Cancer Prevention and Wellness series. You have a lot of expertise on this topic and lots of good experience working with patients themselves. This is part of a larger effort with cancer rehabilitation within Prisma Health Cancer Institute. We also do have other clinics. Molly works very closely, like we were mentioning, with our Moving On program with oncology rehab. We also offer an integrative oncology and survivorship visit that does a good job of assessing a patient's needs from the beginning and really working with them throughout their survivorship journey, starting from the day of diagnosis onward. We have psychosocial support as well that is well managed by Carrie Sesko, one of our counselors, as well as a cancer support community to help people keep moving and also develop community with those that are experiencing similar journey. Thanks again, Molly, for being with us. We're so appreciative. And I just want to encourage everybody to join us in the new year. January 2026 is when we'll pick up our series again. Thank you again for being with us.